Hey guys, this is Brock Fraser from Command Family Medicine, and today we're going to talk about GLP1 receptor agonist medications like Ozempic or its generic Semaglutide. But first, this is not medical advice. Make sure you talk to your primary care provider in order to really weigh out the benefits versus risks for you. And I want to start by talking about side effects and contraindications to taking these medications in order to set kind of a tone of caution here, because we don't fully understand how these medications work, nor do we know their potential long-term side effects. And so for contraindications, if you have a history of allergic reaction to semaglutide or to semaglutide's components, if you have a personal or family history of medullary thyroid carcinoma or a personal history of multiple endocrine neoplasia type 2, then generally these are going to be contraindicated for use, but make sure you talk to your primary care provider about that. As far as side effects are concerned, the most common side effects we see generally are of the GI system, things like abdominal pain, nausea, vomiting, reflux. There are some other miscellaneous side effects like headache or sore throat, probably 20 to 30 possible side effects that we know of. Honestly, like most prescription medications, there's quite a list. And then some special considerations. There's an increased risk for acute kidney injury, diabetic retinopathy, pancreatitis, gallbladder disease. Muscle wasting or decrease in muscle mass is pretty common in individuals taking these medications, and so it's important to talk to your doctor about maybe ways to stave off some of that muscle mass, perhaps through resistance training and high protein diet or something. And then an extra word of caution around this idea of thyroid cancer, increased risk potentially for thyroid cancer on these medications, because rat studies have shown that in rats exposed to semaglutide, there was a significant uptrend in thyroid cancer in these rats. And so while we don't know the relative risk to humans, there's definitely a caution around this idea of thyroid cancer risk. So how do these medications work? There's probably 20 plus ways that these medications affect the body, but some of the biggest things it's going to do is it's going to slow down gastric emptying, it's going to improve your satiety and decrease your appetite. It will increase the amount of insulin that your body secretes, which will allow more sugar to be transported from your bloodstream into cells, because insulin is kind of the gatekeeper of cells and allows nutrients in. When your body produces more insulin, it allows more of that sugar to go from your bloodstream to your cells, which will lower your blood sugar levels. And also it helps decrease the sugar production that your liver can do, which will further decrease your blood sugar levels. So you can see some reasons how it's so beneficial for type 2 diabetes. And for weight loss, because you have improved satiety and decreased appetite, you're going to be generally eating a lot less. It's going to help you diet better. And that's really where I think a lot of the benefit for weight loss comes into play. Lastly, it seems to preserve the insulin-secreting beta islet cells of your pancreas, and we know with type 2 diabetes that disease process can destroy these insulin-secreting cells of the pancreas, and so this medication can help stave off some of that destruction of those cells, which will allow your body to continue producing insulin on its own instead of growing dependent on insulin supplementation. For dosing, we usually start at a low dose and we increase maybe every month or so, usually several bumps in dosage in order to get to that kind of target therapeutic dose. Other considerations is that we still recommend diet and weight loss for the most part. If you're taking these medications, of course, consult your doctor, but it's not necessarily a complete cheat code around the need for some holistic lifestyle changes. And also, when we're considering prescription medication, we have to balance between the risk for side effects and how bad your health is, how much we really need to decrease weight or improve your diabetes management. When we are considering a prescription medication, sometimes we're trying to shortcut around willpower. Sometimes we haven't actually done a good job of putting forth effort into diet and exercise in order to see those improvements in health that we're looking for. For, I would argue, the majority of people, getting in a caloric deficit by dieting effectively will generally lead to significant weight loss. Now, can these medications speed that process up? Sure, but remember that medications don't always give you the complete holistic benefits of getting more fit. They might help you lose weight or control your blood sugars better, but it can actually reduce your muscle mass, and it's not going to increase your cardiorespiratory fitness, which is hugely important for your longevity and your overall metabolic health. So it's not a complete shortcut, and that's just a point that I really want to highlight. Semaglutide, some studies are saying have around 8 to 10%, maybe even 10 to 20% total body weight reduction in about a year or so. And then it's important to note that Tirzepatide, which is a slightly different medication, actually seems to be more effective than semaglutide, but there is a shortage for tirzepatide, and in some cases it's more expensive, which leads us to the cost for these medications. Commercial price is often around $1,000 for these GLP-1 medications, but at command, we can get these medications compounded, whether it's semaglutide or tirzepatide. We can get them compounded through Empower Pharmacy for a fraction of the price. And so for semaglutide, you're looking at around $100 to $150 a month. And then for tirzepatide, add another $50 to $100 a month on top of that, knowing that there's a chance that you're going to get even more benefit from taking tirzepatide. So guys, I hope that was a helpful overview of these GLP-1 medications. As always, talk to your doctor about this. And remember that when we become unhealthy or we develop medical symptoms, very often it's because we're not covering the foundational aspects of physical health or mental health or spiritual health, that sort of thing. And so we don't want to overly rely on medications or end up having a ton of side effects or bad medical events from overly relying on medications. So just an encouragement there. Of course, ask your command provider if you think you might benefit from one of these medications, or if you're just looking for advice on achieving weight loss or better control of your type 2 diabetes. And with that, thank you so much for your attention, and we'll catch you in next month's video.